Chapter 20 Responding to Information Overload and Building Options into a Core Curriculum with Threshold Concepts. Alongside a core curriculum that provides the necessary breadth of study, options and electives provide an opportunity for students to study selected topics in more depth. The problem of information overload. Information overload is one of the biggest problems facing students today. Advances in medicine and the so-called information explosion have led to an increasing and potentially intolerable burden for the student. Curriculum committees are expected to pay attention to new topics and topics of particular concern such as team skills, professionalism, pain management, care of the dying, health education, and personalized medicine. It has to be recognized, however, that the time available in a curriculum is finite and teachers cannot pack more and more into an already congested curriculum. They need to ensure that the time available is put to best use. Figure 20.1 Information Overload, a major problem facing medical education. Responding to the problem. In responding to the problem of information overload, the teacher should recognize the need for students to move from simple fact memorization to higher level learning objectives, including searching, analysis, and synthesis of information. Help students to develop expertise in accessing and retrieving information for themselves rather than teach students more than they can learn. A theme running through the book is the changing role of the teacher from information provider to someone who opens the door for learners to find information when they need it as a student and later as a doctor. Students need to be prepared for the future of practice where information is readily available to the doctor and the patient. Emphasize the core or essential learning required and the essential threshold concepts. Students must have significant knowledge from the core curriculum to be able to frame a good question and to ask for more information from appropriate sources. Provide the students with the opportunity to study areas of their choosing in more depth during electives or student-selected components. A core curriculum with options or student-selected components. Every curriculum should have both core curriculum elements and options, described as electives or student-selected components. A curriculum based on a core with options or electives, as recommended in 1993 by the UK General Medical Council in Tomorrow's Doctors, was a major development in curriculum planning. The precise place on the SPICES continuum between a standard and uniform curriculum and a curriculum entirely based on student-selected elements has to be determined by a school. The SSC is normally allocated 30% of the available curriculum time and 90% of the time allocated to the core. For the SSC, this is equivalent to half to 1.5 days per week or 9 weeks in an academic year. Advantages of a core curriculum with SSCs. A core curriculum with SSCs embedded offers a number of advantages. The core curriculum highlights the essential learning requirements for all students and is consistent with an outcome-based education approach as described in Section 2. The establishment of a core curriculum helps to counter the danger that increasing specialization in medicine will dominate the curriculum. A description of the core curriculum helps to determine the equivalence of training in different schools or countries and facilitates the mobility of doctors. The core curriculum provides a standard against which students can be assessed. Students have the opportunity to cover the breadth of knowledge in the core element of the curriculum while at the same time they are able to study in depth selected subjects of their choosing. Special study modules may be offered in subjects not normally addressed in the curriculum. Experience of a subject during an SSC may help students with regard to their career choice. Completion of a series of SSCs in a subject may count towards postgraduate training in that area and shorten the duration of training. It is not the norm at present, but may be more widely recognized in the future. Teachers value interacting in SSCs with an enthusiastic group of students who have a special interest in their subject and who might be the researchers or teachers of the future. Figure 20.2 core learning outcomes should be highlighted. Specification of a core curriculum. The specification of the core curriculum should be the responsibility of all the stakeholders, including the clinicians and basic scientists. It should not be left to each discipline or specialty to specify the core curriculum in their area. The content can be determined as described in Chapter 9. Topics merit inclusion in a core curriculum if they are common in clinical practice, representative of a serious or life-threatening situation in clinical practice, an important prerequisite for other learning, and illustrate an important principle. The core curriculum is reflected in the Statement of Learning Outcomes as described in Section 2, problems presented in a PBL curriculum, patient presentations used as a framework for the curriculum, learning opportunities provided for the students, the assessment of the students, threshold concepts. Threshold concepts are a relatively new idea in medical education and have not been widely researched or applied. Given the problem of information overload, however, it is an approach that merits further consideration. Threshold concepts were identified in a report by the Open University in the UK as one of the new pedagogies with the potential to bring about major shifts in educational practice. A consideration of threshold concepts helps teachers to make decisions about what learners need to understand relating to a topic if they are to master it. This has been described as the portal or gateway giving students access to a new way of thinking. For the student, they are the eureka moments in learning that open up previously inaccessible ways of understanding something. Key characteristics. Mayer et al. Describe the key characteristics of a threshold concept. For better understanding, we have used a gardening analogy. They are transformative, bringing about a significant new perception of a subject. A threshold concept in gardening is that plants require different amounts of water for their cultivation. If this concept is ignored and all plants are provided with the same amount of water, some plants will fail to grow. They are integrative, exploring connections that may have been previously hidden. In the gardening analogy, the understanding of water requirements leads to a better understanding of soil requirements. They are irreversible and unlikely to be forgotten or unlearned only through considerable effort. Once the principle is learned that plants require different amounts of water, this is unlikely to be forgotten. The student may forget, however, how they mastered the concept, and the teacher may forget their own struggles mastering the concept. They are troublesome in the sense that they may be counterintuitive or seemingly incoherent. Common sense may in fact inhibit mastery of a threshold concept. That plants with similar appearances have different water requirements is not obvious, and those who previously thought that plants need similar amounts of water may have difficulty in changing their beliefs. The importance of threshold concepts. There is competition for time and space in the curriculum, and a consideration of threshold concepts can contribute to decisions about what to include. Failure to grasp the required threshold concepts may prevent a student from progressing. My granddaughter successfully coached a fellow student who had repeatedly failed the maths examination at school, and this had prevented his progression to the next class. She found that the student lacked an understanding of a few basic principles in maths. Once this was recognized and the principles mastered, the student went on to perform well in maths examinations and progressed normally. In a spiral curriculum as described in Chapter 14, it is helpful to identify the threshold concepts that are required at each stage of the curriculum and necessary as prior knowledge for the next phase. Electives SSCS. The concept of electives is not new. They are often undertaken overseas and provide students with an international focus and opportunity to experience different cultures. What is different with the core and option curriculum concept is that the options or SSCs can be varied, are closely integrated into the curriculum and contribute to the core curriculum outcomes. Learning outcomes for the elective curriculum may be content independent and embrace higher order competencies such as independent learning, self-assessment, and professionalism. It is through the options that students may have the greatest opportunity to direct their own learning and to learn to assess their own progress. Choice of SSC topics. A wide range of topics can be addressed in SSCs. These include a more in-depth study of subjects included in the core curriculum, with a reduction in time allocated to basic sciences in the curriculum. Students with an interest in the area have an opportunity to study anatomy or another basic science in more depth. Special aspects of clinical practice such as plastic surgery not covered in the curriculum. Topics unrelated to medicine but of possible relevance to a doctor's future career, for example, the study of a foreign language or business studies. Medical education and teaching skills. This is now offered as an option in a number of schools. We have seen students make useful contributions to the curriculum and generate useful learning resource material during an SSC. Interprofessional experiences, for example, working as a member of an interprofessional team or shadowing a nurse. The latter proved a popular SSC in Dundee, but mainly for female students. Research, which may be clinical, laboratory-based, or educational. Students may choose from a list of options provided by the medical school or identify their own area for further study which is approved by the school. Assessment of SSCs. The assessment of SSCs should be transparent and related to the contribution the SSC makes to the learning outcomes for the course. The assessment of students' performance in SSCs must be integrated with their overall program of assessment. The SSC assessment should be used to determine the students' progress alongside their performance in the core curriculum. A range of methods may be used. Portfolio assessment, as described in Chapter 33, offers a number of advantages. Problems relating to fairness and equivalence need to be addressed, given the varying nature of different electives. Integration of SSCs with the core. SSCs can be integrated in the timetable with the core curriculum in different ways. Sequential. A block of core teaching, for example 8 weeks, is followed by a 2-week SSC option. This allows the student to explore the subject of the preceding block in more detail or to study an unrelated subject. Intermittent blocks of time, for example 4-10 weeks, are allocated for SSCs at set times in the curriculum. Concurrent, the SSC topic is scheduled for half or 1 day per week alongside the core but on a topic not necessarily related to the core. Integrated, the SSC is integrated within the core topic program, allowing the student to study different aspects of the core in more depth. One option for an endocrinology course offered at Dundee was for the student to choose between exploring in more detail the laboratory investigation of endocrine disease, endocrine surgery, or the management of endocrine problems in the community.